Did you know there are 6 million people with pacemakers? Did you know 1 in 3 people will get kidney failure and need the life-saving treatment of dialysis? Did you know in 1952 there were 58,000 new cases of polio and now there's less than 120? These are just some examples of the new medical advancements in the last 60 years, along with CAT scans and the Human Genome Project. It all started in 1943 when Dr. Wilhelm Kolff saw one of his young male patients slowly and painfully dying from kidney failure. He wanted to help him but quickly realized he couldn't make him a new kidney, so he came up with the idea to make him something that would do the work of a kidney. He studied many other researchers' work, but none of them were giving him any new ideas. He knew he had to make something to clean out all the toxins from the blood that were leaking from the failing kidneys. He took household items such as sausage skins and washing machines in order to figure out a way to clean the blood. When he first tried this on patients, it didn't work. After 16 failed attempts, he finally figured out a way so that it worked properly. In 1945, he saved his first patient, who was a 67-year-old woman in a coma from her kidney failure, and after a few hours of dialysis, she regained consciousness and continued to live on her life. Since Kolff's invention and discovery, dialysis has improved. It now saves millions of lives worldwide. Even though the treatment plan isn't perfect yet, we are still learning as we go. Patients have to go a few times a week to the doctor to have it done, but the results are improving. Most people who use dialysis usually improve their kidney function and have full functioning kidneys once again. The average person on dialysis, depending on their age and severity of the disease, lives an average of 5 or more years, while the average person with kidney failure without dialysis treatments lives about 1 year after prognosis. In most cases, dialysis helps within a few months. These statistics show how kidney dialysis is improving the lives of many. In the 1950s, polio was a fast-spreading disease. In 1952, there were 58,000 new cases, and thousands of those turned into casualties. Polio is a disease mostly in infants and young children that causes paralysis along with many other symptoms. It is spread virally from person to person, so without a vaccine, it became an epidemic. In March of 1953, Dr. Jonas Salk announced he made a vaccine for polio. Once injected into the bloodstream, the vaccine would create antibodies and fight against polio if it ever did enter the body. In 1954, clinical trials were done, the first being on 2 million school children across the country. In 1955, it was announced that the vaccine was effective and safe. Once the vaccine was released to the public, the number of polio cases dropped from 38,000 a year to less than 2,500. This created less casualties nationwide. Now, since more and more people are getting the vaccine, there are less than 120 cases of polio currently, but most were imported from other countries. The typical time to get the vaccine is as a child, but adults can get it as well. Without the polio vaccine, thousands of people would have this disease and it would continue to spread tremendously. Many people know of a pacemaker used in many modern heart surgeries, but did you know it was made by accident? Yeah, you heard me right, by accident. In 1952, William Greatback was building a machine to record heart sounds when he pulled the wrong resistor from his box. When he put it back together, he saw it sent out electric impulses which he realized could be used as a pacemaker. His first victim was a 77-year-old who lived with the device for 18 months before he died, which was a huge accomplishment. Before Greatback made this implantable device, they were the size of televisions and actually shocked the patient, while pacemakers now send small impulses into the heart to get the rhythm back in order. Arrhythmias is any irregular heartbeat, can kill about 500,000 people annually, but with a proper treatment and diagnosis such as a pacemaker, can cut these deaths by almost 100% without other complications. With the use of the pacemaker, more and more families will be able to spend time with their loved ones. In 1972, Godfrey Hansfield and Alan Cormack made the CT scan, or as most people call it, the CAT scan. A CAT scan is a device used to take pictures of the inside of a person's body. The device takes many X-ray pictures and combines them to form a topographical image of the body. This allows doctors to see what is wrong inside of their patients. In 1972, the first CAT scan was made just to see the inside of the brain, but since then has improved. Now CAT scans take up to 5 seconds for certain parts of the body and can take better quality images than before. The most crucial use for a CAT scan is in trauma patients because it's very easy to detect internal bleeding, which helps save lives. CAT scans allow for easier diagnosis and no more other expensive imaging. In 70% of people, CAT scans help prevent high-risk surgery that may not be needed after reading the scans. And in 90% of cases, CAT scans help doctors avoid other expensive imaging of the body. This not only benefits the patient, but the doctors as well. One of the more recent and ongoing discoveries is that of the human genome. This has been going on for many years, but in 2001 it grew. A group of researchers and scientists published the first human genome research book to explain what this really was all about. The goal of this project is to map a person's DNA and detect what each gene stands for. This way, once enough information is known, doctors can help prevent certain birth defects and diseases and eventually help cure some of them. They have detected that there are about 20,500 genes throughout the body, which differs from previous researchers who thought there were either 50,000 or 2,500 genes in the body. This project began in 1990 and will continue to be going for decades more to come. Being able to know how to cure or prevent diseases will help the human population in the future. As you have seen, there are many new and ongoing discoveries in the medical world since 1945. Whether it be something as small as a vaccine that can save thousands of people, or a huge project that at the time hasn't saved anyone, there was always something going on. These top 5 medical advancements have shown what diseases people struggle with and how to help them in the future.